Dr. Mongkala, working as a medical officer at PHC Mongsenyimti. On behalf of the CMO Mokokchung and staff of PHC Mongsenyimti, I would like to share with you all our journey to achieving the NQAS certification through a short video presentation. We even worked through a global pandemic for 2 years, and finally, in the year 2022, we achieved the NQAS Certification Award, the first PHC in Nagaland. It was all possible because of support from our CMO and staff, and also from the directorate, and support from the community, starting from the community leaders down to the common villagers. Without their support and without their encouragement, this certification would not have been successful. So I would like to encourage each and every one of us that the road ahead is not easy, but it is not achievable either. So we should all try and give our best to give quality services to our people. Thank you.
Health Center presenting to you our short journey to NQAS National Certification, and I am Dr. Nyumai, the Medical Officer in charge. Our NQAS journey started in the month of August 2021 after the training of MOs at the district level in the CMO office, and then training of staffs at the health center. NQAS as such was new to us and my staffs because the previously trained doctors and nurses, some resigned and some got inducted into the state service. We began with the cleaning of our health center, as the center was in a mess, with the building of new rooms for the X-ray machine, and also because KL Cup inspection was coming. We did our internal assessment in the month of November. We first did in the month of September and then in the month of November, but there was not much difference. In November, we scored 76%, and this was sent to the district level. We had several gaps, but most importantly, our record keeping was very low, so we started working on it, and so now we have over 100 registers, formats and files where we update regularly. And actually this has made us more easy to analyze our performance now. Another gap is that we needed several trainings to update ourselves, and also this was required for NQAS certification. Many trainings. This was possible because of our CMO and Deputy CMO, along with our quality manager, Dimapur. They organized and we could conduct these trainings. That is, officials from the fire department, they came for inspection of a health center to give us no objection certificate on fire safety as a mandatory for the NQA certification. Infrastructure-wise, our center is presentable, but we did not have ramps with rails and also disabled-friendly toilet. So in due course of time and with the untied fund which we received, we have made the ramps with rails, and we now have 2 disabled-friendly toilets. Biomedical waste management was easy for us because in the year 2020, with the help of the NHP, our deep burial pit, shark pit, the biomedical waste area was already made. That is a glimpse of our minority. I wanted to show the liquid waste management, but it's not very clear out there. We actually thought that we will work each month, each checklist monthly, but by the end of November, we were earmarked for NQA certification. So we really had to speed up our work, especially the paperwork. So we really ran like a horse. By February 2020, peer assessment came and we scored 84%. In the month of March, state assessment came where we scored 86%. And by May 2020, on 6th and 7th, the external assessors came. We thought we did not reach up to the assessor's expectation, but we were very anxious until the result was out, and we are very happy that we scored 84.9%. My greatest challenge was a shortage of nurses. I had only 4 nurses and one was heavily pregnant, so it was very tough for them. And with the OPD and COVID vaccination in full swing, they really had to work overtime. And moreover, we had this time constraint. But with their dedication and hard-working staff, including all cadres, with the hand-holding support from the district and the state, and teamwork and coordination, we are now NQA certified UPHC. With the center being NQA certified, we are more confident and proud to be working in UPHC Burma. Teamwork, dedication and coordination are the key to our success. We will continue to work with dedication and keep up with our motto, quality through efficiency, safety and teamwork. My heartfelt thanks to our CMO Dimapur, Sir Muatamjan, for his constant support, Ma'am Antolisu, Deputy CMO Dimapur, for her constant motivation and guidance, Sir Pusey, State Nodal Officer, and Mr. Autumn, Sir, State Consultant NUHM, without whom I wouldn't be standing here right now. My special thanks to Dr. Almaran, Medical Officer, for his several inputs, Mrs. Vithi Pralu, State Quality Manager, Mr. Imli Noba, District Quality Manager, Mrs. Tushnaro, Urban Consultant Dimapur, Ms. Tirang Sungla, Asha Coordinator Dimapur Sadar. Thank you for being there whenever we needed you. And I would like to thank each and everyone who stood by us. Thank you all.
I must inform you, and obviously all of us will feel proud, that Nagaland is the first state to achieve the target given by Government of India so far certification of urban PSCs are concerned. How many urban PSCs are in Nagaland? 7. Already certified? 3. Because the PSC in Mokokchung, is it an EPSC? No. So it is 3. So 3 out of 7 is more than 30%, I will say. So the target is 25% now. So we have achieved it. And I must congratulate the medical officer, not only the medical officer, also to the staff of those 4 facilities, including Shikajo also. And side by side, I take this opportunity for apologizing to you all for creating lots of pressure on you. But I cannot afford to be relaxed because pressure has its result. Now today you people are happy. I'm sure you are proud. Na? So sir, congratulations to you also. Again, and I'm very happy that Nagaland is also shifting from Naga telehealth to E-Sanjeevani in coming days. Today it will be launched. So it's good. And due to the COVID pandemic, I will say, there is a long gap. I had an association with Nagaland for last 12-13 years, or more than that, maybe 2007 onwards. So I could not come for last few months because of the COVID pandemic and restriction. On arrival this time, we are very happy to note that drug position, the availability of the drugs in the facilities is really good. And the pharmacist, ma'am, I would like to inform you, and sir also, they are keeping it as it is expected, storing it nicely and utilizing it also. It's improved a lot, as well as the cleanliness, obviously. All these things are happening. It's obvious from the field visit that, yeah, there is an effort to improve the situation. Further, I must say one thing that 15th April you all know, and the Prime Minister PMA VIM, Health Infrastructure Mission, there are plenty of money in this. So we should not miss this opportunity.
Our books 210 days, and every day I'm learning new things. This morning also, right now also, I've learned new things from our director here. Therefore, you know much better than me regarding these programs and what you are required to do. However, I would like to compliment not only the 3 health centers who have achieved, but the 4th one, including Sikazo, 2 in Dimapur, 1 in Kohima, and 1 in Mokokchung district. Now you have done a commendable job, as you have shown in the slides. You have gone through all the hardships. But as you all know, this assessment is to assist our work. You know, to check back and how we are doing. What is our score in our workplace? For me, I understand that way. I don't know whether I'm right or not, but this MQAS is to assist our work. You know? Therefore, I think each and every one of us have a pushing there. While complimenting the commendable job by the 4 centers, we also need to reflect whether we are satisfied that we could achieve from only 4 centers till today. When the program was launched 9 years back, and we are still on it. Where do our district headquarters hospitals, the community health centers, the other health unit stands? Where are we today? You know, unlike I've worked in many departments, this department has a unique feature. For every step we take, for every implementation, we get assistance from the ministry. Other departments are not like this, okay? We have 3 programs, 4 programs. But out here we have nearly 30 programs, right? For every step, from our salary till the needle, we are being fed by our ministry. So, of course, our government of India, the number of programs governing throughout the country is based on the assessment taken from all the states, irrespective of the bigger states, the mainland states, or the remote states like ours.
Alignment with the national health policies aim to ensure universal health coverage. Ayushman Bharat was launched in 2018 with Health and Wellness Center. And BMGAY Pradhan Mantri Jan Arogya Yojana is its two strong pillars. Ayushman Bharat aims to bring standard shift in the country by increasing health systems responsive to the increased demand of health seekers and prevention and treatment of diseases. The state have completed 4 years of implementation of the prestigious Ayushman Bharat Health and Wellness Center in Nagaland, thereby bringing quality care close to homes of community with the provision of expanded ranges of services in the entire state of Nagaland. Along with making healthcare services available, accessible and affordable to the local population at their doorsteps, it has become more pertinent to ensure quality of care provided by health care providers is visible and acceptable. Therefore, the Ministry of Health and Family Welfare began its journey of ensuring quality across the public health facilities since 2013. And now, with the launch of National Quality Assurance Program under the embark of Naga, standard of care for various level of health facilities at district hospital, community health center, primary health center, and sub-center has been framed. At Nagaland, Sikojo Urban Primary Health Center is the first facilities to be certified by Nagas in the year 2019. Interestingly, this year, 3 additional facilities were certified. That is, Duncan Urban Primary Health Center, Mongsenyimti Primary Health Center, and Burma Urban Primary Health Center, which is ended a great success and bright moment for the department and the state as a whole. We congratulate and held high your hard work with thankfulness. We look forward to soar higher and with your milestone achievement with motivate and inspire other health units to participate and put more labor for such achievement. I also thank officers, consultants, program assistants, and all involved for timely monitoring and guidance and making this success a reality. They said, Brahman is indebted to your side at Nista Tobago, who has been supporting us at various digital interventions like Naga, telehealth, teletrack, e-learning, e-learn, Naga telehealth, telemedicine platform, which is now shifted to E-Sanjeevani and assisted teleconsultation system to alleviate the urban-rural divide in terms of healthcare services. It works and hub and spoke model. The Ayushman Bharat Health and Wellness Centers act as spokes, which are made with the hub comprising MBBS specialty doctors at hub level. This will enable a patient residing in rural areas to avail quality healthcare services and an easiest way for one's good health. Today, as we launch E-Sanjeevani teleconsultation service, I would like to request the entire district officials led by SEMO and MS to encourage our healthcare workers and general public to make use of the platform for the benefit and well-being of all concerned. I once again congratulate all the facilities who have bagged national certification of NOCAS today. May you all continue to be a healer and savior of the native people. Thank you, and God bless you all.
Senior officers from the directorate and senior officers from the district, we are shifting now from Naga telehealth to national platform, that is E-Sanjeevani teleconsultation services. E-Sanjeevani is a web-based comprehensive telemedicine solution which works through two platforms, that is health and wellness platform, and the other one is the general OPD. Health and wellness platform is where the general public, a patient, can visit the health and wellness center and get the help of the CHO, who will take the history, do the basic investigation and conduct live teleconsultation with the doctors. It will function as in a hub and spoke model, where the hub is the doctor, will be the doctor, and the spoke will be the health and wellness center. The second platform will be the general OPD platform, where the patient can directly consult a doctor from the comfort of their homes. So these services will extend the reach of the specialist healthcare services to the masses in the rural areas and isolated communities in the state. Ministry of Health and Family Welfare aims to implement teleconsultation in all the 1.5 lakhs health and wellness centers in the country. E-Sanjeevani also aims to make healthcare services equitable by bridging the digital divide that exists between the urban versus rural, rich versus poor, etc. With this short introduction, I now request the Honorable Minister of Health and Family Welfare to formally launch the E-Sanjeevani teleconsultation service.
Piles Care Center, address Burma Camp Walford Road, opposite Police Point, Dimapur. Contact number 9863758600, 690-971-7178.